Do you know that your vagina changes during pregnancy? The fact is that pregnancy changes your body. From growing stomach to ever increasing shoe size, there are lots of transformations that come along with pregnancy. Today, in this video, I am going to discuss 7 ways your vagina changes during pregnancy. And at the end of the video, you will discover surprising things that may happen to your vagina when you are pregnant. Number 1 is the color of your vagina may turn blue. Now, the question is, can your vagina color change during pregnancy? Unbelievably, the answer is yes. Your vagina may assume a blue or purple color when you are expecting a baby. This is called Chadwick's sign, and it can be one of the first indicating signs that you are pregnant. As early as 6 weeks into your pregnancy, your vagina, your labia, and the cervix may turn a blue or purple color, thanks to increase in blood flow. The second surprising thing that may happen to your vagina when you are pregnant is you might experience spotting. Pregnancy means a temporary end to your period or menstrual cycle, but spotting in the first trimester is common and it is usually no big deal. In fact, according to research, up to 25% of expectant mothers have some bleeding or spotting during pregnancy. That notwithstanding, anytime there is bleeding, even if it stops, make sure you let your doctor know. Spotting can sometimes be caused early by the implantation of the embryo in the uterine lining and the formation of the placenta. At this point, the blood tends to be light pink to dark brown, but not red. In other cases, however, spotting during pregnancy can indicate something else, such as yeast infection or miscarriage. Normally, spotting is not supposed to come with pain, but when your spotting is associated with pain, then call your doctor immediately. The third thing that can happen to your vagina when you are pregnant is your vagina could get varicose veins. About 10% of pregnant women wind up with vulvar varicose veins, generally during month 5 of their second pregnancy or rarely in their first pregnancy. The risk increases with the number of pregnancies, according to research. They look just like regular varicose veins, but most often occur on the labia or sometimes on the upper inner part. But the good news is that the issue usually resolves within 6 weeks of your delivery. But you don't have to wait that long for relief if your varicose veins are bothersome. Try warm bath, lying on your left side or elevating your feet when possible. Exercise helps too, but try to avoid sitting or standing still for a long time. Now, let's talk about the fourth thing that may happen to your vagina when you are pregnant. The fourth thing that may happen to your vagina is your vagina may be swollen. That extra blood flowing through your vagina area can make you feel full and heavy. According to research, your vagina usually won't appear swollen, but it might feel that way, though that's not always a bad thing. For some people, the extra blood supply increases sensation, according to research, and a swollen vaginal area during pregnancy may improve sensitivity and orgasm. Vaginal flatulence can occur. This is the fifth thing that can happen to your vagina when you are pregnant. Vaginal flatulence, which is also known as vaginal flatus, can occur when a pocket of air gets trapped into your vagina. When it is released, it emits a fart-like sound. It's not a sign of anything bad anyway, according to research. It's unclear why pregnancy causes this type of thing to occur, and this may happen more often, but it's likely the combination of a growing belly, different intercourse position, exercise, or overworked pelvic floor muscles. The next thing that can happen to your vagina when you are pregnant is your vagina could be itchy. Pregnancy hormones can cause an overgrowth of natural occurring vaginal bacteria or fungi, and this can result into bacterial vaginosis or BV or yeast infections. Both are common during pregnancy and can offer up either grayish white or yellowish white infection discharge. They can also cause itching. Luckily, you can be treated. Therefore, report to your doctor when you experience this. If your vagina is expelling an odor-free discharge that's clear or white, relax, it's totally normal. The cervix and the vagina undergo hormonal changes in pregnancy, and that causes an increase in cervical mucus or vaginal discharge. This mucus changes throughout your pregnancy from thick and sticky in the beginning to thin and watery towards the ending of your pregnancy. So relax, it is normal. The seventh and the last thing that can happen to your vagina when you are pregnant is your vagina's smell may change. The pH of your vagina changes during pregnancy, and this could cause subtle change in vaginal smell, making it a bit more acidic. Some people or some pregnant women are more sensitive to smell, but unless there's vaginal itching or burning, there's nothing to worry about. In summary, the 7 things that can happen to your vagina when you are pregnant is: number 1, your vagina may turn blue. Number 2, you may experience spotting or bleeding. The third one is your vagina could get varicose veins, which is normal. And the fourth one is your vagina may be swollen, but it is not going to be painful. And there will be vaginal flatulence, which may occur at all times. The sixth one is your vagina could be itchy or burning. And the last but not the least is the smell of your vagina may change. All these are the 7 things you can experience when you are pregnant around your vaginal region.